The COVID-19 pandemic has overshadowed non-communicable diseases, yet they remain a big health challenge globally. People living with non-communicable diseases are the most affected by the COVID-19 pandemic and face severe complications when infected due to their susceptible immunity. In Uganda, few or no measures have been taken to protect persons living with non-communicable diseases, especially or hear what they go through, since there are hardly any platforms for voicing out their needs and challenges. Uganda Non-Communicable Disease Alliance (UNCDA), with support from Non-Communicable Disease Alliance Global through Solidarity Fund Phase 2 of 2021 on Ncds and COVID-19 project in 4 out of 11 UNCDA supported districts of Luka, Serere, Tororo, and Nakasongola. This fund was aimed at mobilizing persons living with non-communicable diseases to voice out their challenges and needs, especially in the era of COVID-19, and to create platforms where persons living with non-communicable diseases can interact with policymakers and meaningful involvement. During the 6-month grant implementation period, UNCDA mobilized, sensitized and supported persons living with NCDs in 2 groups at health center level to carry out meetings to strengthen each other, voice out their needs, and propose possible solutions to problems they face during the pandemic. Persons living with non-communicable diseases and facilitators share experiences in regards to NCDs and COVID-19 effects.
Wano wendwalira ntira okwida ku wano bankeberaku era omusajja okunkeberaku duzi naida mu mwezi gweno ogwoguvuyireko naida wano okunkebera omusawo yankoba ati muna pressure yekoze eki eninie
olwero bwasooka kunuma bwa asthma bumazeeko emyaka nga 13. Ekifuba kino nziwira kyanesiba nga tisobola kuweera era bandandabira wano bajja bankubeeko idagala mu misi wamu nome n'abanna emirembe.
When I went for testing and I found that I have pressure, and this pressure I developed due to the first lockdown. Because I have children, and the only source I had, it was my job, and we were locked down. So due to that, I developed pressure.
The type of NCD I have is a high blood pressure. I came to know about this disease when I was seriously sick, and I was taken to the hospital. Now when I was introducing myself to the doctor, so he looked at the sign and symptom of my communication and said, we are going to test for high blood pressure. We are going to test for diabetes.
In the same meetings, participants revealed the challenges encountered in the COVID-19 pandemic situation.
I've suffered with pressure for 2 years. And the challenges I've faced during this COVID-19 pandemic, the problems I faced was lack of money to buy the drugs, and also accessing the health facilities due to the COVID-19, the lockdown.
As we are not to move, I find difficulty in moving because sometimes I go to the main hospital when the waist pain is too much. So getting transport money is a problem.
Participants too suggested different solutions to the first challenges.
Now I have a request. If the NGO or the government can help us, the patients, could avail us with the machine for testing high blood pressure within the LS center, or sometimes the LS center is far and you can be attacked at any time, and you also need to know your status at any time. maybe they can extend the machine in the village.
And ku suggesting anti bano bafanda nza bali tamusana akasente abatyamiza wano ndi basaba ni government nti ebikozesebwa mu idwaliro ndi basaba nti babitewo in plenty kuba n'ekindi kyendi kwenda nti mobilization mu kyalo ebeemu ningina okusomesa ino abantu mu byalo n'okwongera otraininga abasawo baife abali ku facility.
During the persons living with non-communicable diseases meetings, some respective health facilities in charge and other meeting facilitators shared information on NCDs, self-care and prevention.
We've realized that the number of clients that we are getting with NCDs has increased compared to the previous times when we could not frequently check most of the adults. My observation is that these days with this NCD program, we have seen the number every day increasing and increasing and increasing. And I'm wondering whether something has changed, but the truth is a big number of especially elderly people above the age of 50 years. Most of them, when they come and we check, we find their sugar level high, we find their blood pressure high. The good thing is that we are able to manage these conditions. We have the drugs, although most times these drugs run out of stock. Like as I'm talking now, we find that most of the drugs that are used to manage blood sugar and the blood pressure are out of stock. So what we are doing most times is we encourage them to buy from the nearby drug shops.
Basically, when we look at NCDs, non-communicable diseases in the district, we have a very, very big challenge. A lot of focus has been put on HIV, on TB, and but very little has been put on combating non-communicable diseases. We have problems like, for example, I'll give you an example. In Abisura Health Center 4, we have about 5 to 6 patients who constantly come in wanting insulin, injectable insulin. We have, on average, every clinic day in Abisura Health Center 4, we would have about 10 to 20 patients suffering from high blood pressure, coming for drug refills. The medication that we get in our health center 4s will cover just a few patients.
However much NCD is trying, however, the community still needs more campaigns, more information about NCDs. Some of them are living without knowing they have the NCDs.
Other participants attending the dialogue were community opinion leaders, supporters and well-wishers in 8 health facility service communities who shared perceptions on NCDs and NCDs services.
Nale bulungi ekyeyigulo n'alamba dyesa musanvu n'atandika okufuka wajja okukyala kunchonga baafu ibiri n'awuna enkyo n'ajja mu idwaliro ojja okebera nga sukaali ali 27 bakaba omusaadde oli musawo tujja kwekebera bikoze mba tibeyeeko na sayini yona yona
ne bankebera naye nga teri nnuma n'okunzijjako akanyama nga teri nnuma ekimu kyonna nga tekinnuma owuli era nga nze mmanyi nti bagenda abaana ne bangamba oba amabeere abiri mwe mulimu akantu bagasaleko gonna. Ekikulu nina omwana asembayo omulenzi myaka 25 last born wange nino emyaka 61 naye nga tebadde ng'ogenda mu ddwaliro ng'obuuza bana akantu kali nkole ntya ne bangamba kalina kuvaamu tugenda kajjamu bujja ngeri gye nafunamu pressure entonotono naye tugenda kujjamu ki kantu era ngenda okumanya nti ebbere baliggyeko nga nvudde mu theatre naye mbakubiza kabeere nga kali wano mu mukono akabeere nga kali mu kugulu. Nze nina muganda wange ali abamuziika wano Reverend Kanoni Waalu yeekona bwekonyi ku ntebe naye tugenze omuzika ali wano ewatte basuulwa wano tugenze omuzika nga amagulu abiri tekola ki tegaliiko kwekona bwekonyi bwolaba nga ekintu tekiwona dduka mu ddwaliro
amaani gekisada gagolola gavuwa ku cwe nakondika itabu kye era nabanja kuzirikana naye mu ddwaliro nakomplaina kuba bankansolinga ndio mwe kuda kwira kumpola mpola cyo
n'abakazi basatu aye abakuba ntwazana nabo abaana myaka giweze kwaye ngoli bagolala maani gampwa gasalira alago mu kisenge kati nzirangeri yona mama
Nidwaliro biwashuru wanike shuma oda nyowanu wango gigangwa shimani piyo
the purpose of her request is that at time they move up the health center tree most times when they reach the health center tree they find that the machine or the gadget they use there for measuring their pressure or whatever they are suffering is dead.
Ani atonga paran maduong tatake idakuya kirino yaurwetu Kenyo clinic.
She also needs to know that there is a particular part department
Rupira maro pino kumira, okay?
She used to go there for testing.
Akidanie wanyewe ye.
She used to just go and buy her own drugs.
Takwayo ne luenyiruwa wini be wanu wangu ye ni mawa niti clinic mawa no.
She is requesting that let there be department where they can also go and get the drugs from.
Rupira
okusooka emyaka gibisewooko nalwala omutima nga ndi muvubuka wanuma emyaka gyayera 14 naawona bwe nawona akawonero ekizibu kyasobola okufuna butanwa maadi paka olwalino maze emyaka giyera kamaala buti 18 kino tuwulira nooto y'amaadi ngano just buno okukuba nti kyeyagalire ayi ningensiga mukasana ningenkola emirimu tuwulira nooto y'amaadi egano ekisebe kyabita nga bisobola ndowooza emyaka giri 4 najja okwekebeza ati pressure akoze eki andemi najja nga ndi mulamu bwaleko kange.
Participants also had different perceptions on COVID-19 and COVID-19 vaccination.
I got affected with diabetes. I was getting his treatment from Bukang Health Center 3. But when I always visited the health center, they were eliminating me because of COVID. When the health workers doesn't want to attend to me, when they are suspecting me to be a victim.
Lockdown kyakusanze nga kifuna idagala aye Katonda yanamba nti pegana kudino bwenye okwekebezaako aba mu 13 kinana olusi 35 kinana atyo
yatukosa ino kuba ndi omu ku bantu ababitibwa n'amaze okufuna okukeberebwa nga ni sukaali mwezi ogw'omusanvu na kuto mwezi nga ina.
So for social media, when somebody who had already got the vaccine and they were trying to put a bulb here that it lights, when you put a magnet anything it remains here. So those are things that are scaring people from getting the vaccine.
Only rumors, but I don't know what that thing is. But only rumors for that. Some people can say that thing is not good, you can pay in a lot. If you finish 3 years, you can die like that.
The dialogues also acted as platform for sensitization on prevention and control of non-communicable diseases and COVID-19.
Most of that information is myths.
So, jobe e joko na lo city ijai ino to jo serera center ijabe le bono joko no nana ino to jo kati kadungu numina ache para tamine ngasama ene kadungu ota no kansa mina mami mambere chunyonyo e kato lo nyo le corona ira go jabu ne ra papa dona ti de munara akima papa
Let's count ourselves fortunate that we have the COVID injection vaccine being administered in Serere Health Center. Some of these health centers, those people are far and they rarely get that vaccine immediately. They also have to come back here to Serere. I am 72 years and I went for that vaccine and nothing has happened to me. I've had the vaccine, I am perfectly fine. So don't get scared and say that when you are old, over 60 years, you will die. You will not die because it is a testimony to it. Well, we had a number of issues they came up with as to why they were laying fears not to go for vaccination. We have tried to talk to them. Let me hope that this sensitization we gave them will be able to open them up and go for vaccination.
The groups tufune engeri gye kituyambamu ebintu bye twetaaga okubeera kati ng'omulwadde wa sukaali wetaaga okubanga okebera sukaali wo oluvannyuma lw'obudde.
Mu gurupu eno buli kirwadde tulina be tukaddemu. Abalwadde b'ensimbu balimu nga basatu naye nga bagenda beera n'ekitabo bawandiika abalwadde baabo bonna. Kati bano abasatu be balina okujja balinga boogezandi abalwadde b'ensimbu naye n'abesukaali nabo balimu ng'abantu 8 bwebatyo naye nga lisiti yaabwe mu kitundu bonna bali mu katabo.
Dr. Agaba Biamukama, the District Health Officer, Nakasongala District Local Government, while addressing the community dialogue, highlighted the importance of NCDs clinics in health facilities.
This observation is as a result of knowing that there are many people who have NCDs and who are not aware of their status. And the moment you put the clinic once a month, some of these people will be denied opportunity to access the right health worker who can do the needful, see that they are served very well. And also people who have chronic illnesses need more time with the health worker. The moment the clinic is running once a month, you will have many patients standing up on a particular day and you will not have adequate time to be able to sit with them, counsel them, study their problem, and treat them appropriately.
District-based dialogues were also conducted to discuss the findings from the project so far for an all-inclusive way forward to improve NCD services in the era of COVID-19.
Help us. Apart from the IEC materials, the Chief Administrative Officer and you budget your health facilities. Put in also the equipment required. Like he said, if we can have a temperature gun here every now and then, a temperature gun. What about just some blood pressure machines and some of those other things? That's a big prioritize.
You do not want to lose the heart of humanity because somebody is bothering you because they have diabetes, because they have this, they have hypertension. This is still our role and responsibility.
If it was like a pull system, like in the hospitals and health center force, I think we would be able to requisition for drugs that we need at our level as well.
We can do on-site mentorship and incorporate also CMEs on NCDs to bring these health in charges on board so that we are sure they can be able to do what? To provide the correct treatment and support for our clients.
Issue of drugs. These drugs like metformin and metformin and maybe the other drugs meant for high blood pressure, whatever. Are they under the essential drugs? And if so, why don't we ensure that at least these drugs are there continuously? And at our health facilities, and actually all of them, all the health facilities in the entire district, so that people can easily access them. As he puts it, they are very, very expensive. And this is a person who takes drugs the rest of her life. It's like a lifetime exercise, activity which you have to fulfill. And they are very expensive out there. Is it under the essential drugs? And if so,
can't the ministry improve and say that we have these medicines constantly?
District COVID-19 task forces made some recommendations in regards to persons living with non-communicable diseases.
First, instant screening to be done by the health workers. When someone comes and presents with any sickness, first screen for some of these NCDs. And then two, governments will make available the IEC materials. And three, the medicines will be available.
But also as a district, we're ensuring that we plan for equipment. Wherever a patient is able to come to the facility, they are able to check themselves and also be able to be attended to.
But of course, other than sensitizing, we are going to ensure that we tell them that they should also take medications timely. Because if you don't adhere to medication, you will not survive. For example, diabetes.
The President has directed that every week the RDCs will go to the radio twice, on Wednesdays and Sundays. So I don't know who I can contact, so that at least every week once, as I go to the radio, I get someone who can make, just a good statement. Doesn't have to be long stories.
But for me, I'm there at your disposal. Whatever you think that I can come in and do, I'm always there. I'm always on radio, I'm always in the communities. I will speak about this alliance and what it is doing, and we also tell people what is required of them so that we can work together.
A national level stakeholders meeting was conducted to disseminate project results and discuss NCDs and COVID-19 situation for all stakeholders, way forward to better NCDs services in Uganda, basing on views of people living with NCDs and their caregivers.
I was declared cervical cancer free early this year. I underwent surgery. Around what you are talking about, the myth, but also discussing cancers related to reproductive health is very difficult. Many times people don't want to talk about cancers caused by sexual STDs, sexually transmitted infections. And just like prostate, a number of people hide. So I always talk, I'm HIV positive from 1994, and I'm aging, I'm now 52. So as we age, NCDs come in easily because our immunity is suppressed. So for me, I have a combination of HIV, and so I'm aging, and then immunity lowers, and then the cervical cancer takes precedence. So I was lucky, I had surgery. I raised the money and I did a radical hysterectomy. Those of you know what that means. Because my mom died of ovarian cancer, my dad died of lung cancer, my son died of lymphoma, my brother died of urinary cancer. So I did not want to take any chances. And so I was told after surgery that I'm lucky because my ovary was also having some illness, but they were thinking it would have come to get cancer in the future. But I thought I needed to remove the entire system to survive. But how many people are confident to do that?
Before I came here, Kasese district was one of the few districts that have been selected. We got some few partners who gave us some facilitation to have massive vaccination of COVID-19. Massive vaccinations are going on, yes, countrywide, but massive, to pilot it in the country and see whether we can massively vaccinate all the 18 and above. And when I was because I'm part of I co-chair those meetings, during my mobilization in the church where they sent me, I got an old woman who is our client, who is our partner here. He has multiple NCDs, multiple. She called him after because we are supposed to take a message so that people can understand what the exercise means and includes, especially on the vaccines themselves. Remember, they are talking about Johnson & Johnson, doctors are aware of that. and the people wanted to see how there may be the difference between other vaccines and Johnson & Johnson, because it's a single dose according to what they are talking about. So she wanted to know. I could see how this person is suffering. She doesn't have chance of attention, so she called me. Unfortunately, I'm not a medical worker profession, but I have general knowledge about the administrative part of it. So she was like, now, me, I have multiple diseases. She has hypertension, diabetes. She has even that, she's a victim of the other one. You know what I'm talking about. And she was like, now what do I do? All along she has been shy not to go for that. But it's like when we talked about it, we are becoming more vigorous in the implementation of this exercise. So she was like, if I don't get this card, maybe I'll get the problem. How do I do it? So I saw a gap that this person should have known these 2 years down the road that we are under this pandemic, Doctor.
The districts will farm beauty machines. However much, I want to thank for that effort, but however much it was done, I think it is long overdue, because some of the beauty machines ran out of service, and during when patients visit the health centers, like ours, Naksongwela Health Center 4, you see clinical officers and medical officers running up and down looking for beauty machines.
Some participants in the national level stakeholders meeting raised concern that sensitization campaign about the NCDs and screening services is the only way to address NCDs in Uganda.
I want to appreciate at the beginning the NCD Global for partnering with the Uncda for this Civil Society Solidarity Fund. I want to say that actually the fund has now allowed people living with the NCDs to have a platform to raise their voices, to raise their concern. They are now doing it. They are doing it, like in Tororo, we have 4 health facilities which are now carrying out these activities. And people really hold, those people living with NCDs hold monthly meetings at their clinics.
At district levels, you will find that cancer seems to be taking the upper hand. The reason is that the people who are affected by the cancer seem to take low pace towards services that are brought to them. But as we went, by the time we were organizing the NCD groups at the health center level, most of the group and the members who were testifying, giving the testimony, are on diabetes side and the hypertensive. By the cancer, people seem to be quietly there, dying.
Thank you.